Welcome to DC Trainings. We're in week 7 of module 4, which is the report of findings module. And what we need to talk about for this week in week 7 is two things. We need to talk about establishing family care for your new patient and for passing your patient over to the CA at the front desk at the end of the report of findings. So, as an opportunity to bring in new patients to your office and to spread chiropractic care to more families around the world, it's very important that at the end of your report of findings, after you've adjusted the patient, that you turn and you address the patient's spouse and you invite them to come into the office. And I don't mean that literally yes, but not scripted. What I mean by that is that you're going to address the spouse pertaining to some concern that you have about their posture, or about the way they're sitting, or about some comment that they've made about similar problems that they've had with their health. Look for those cues during the report of findings so that later you can initiate a conversation. And I mean later intentionally because you're not going to do that during your report of findings with your patient, because they're obviously the most important and they're on the hot seat. But after you're done with them, then you can turn and you can address the spouse. Let them know about an observation you made with uneven shoulders, anterior head weight, an antalgic position, that they're sitting in, some feature that you notice that indicates that they may have subluxations in their spine. And from there, then, after that's accomplished, invite them in for an examination appointment. And if you need to, make it a, just a brief exam or something to check their spine and really let them know whether or not there's something going on. In addition to that, we want to invite in their children. And the way that I look at inviting children is that if a parent has subluxations, there's a possibility that those spinal traits, if you will, might have been inherited for their children. So from that standpoint, if subluxations could be an inherited trait, kind of like crooked teeth, which, by the way, with crooked teeth, you can inherit crooked teeth, but it doesn't mean you're stuck with crooked teeth. You could get braces and get your teeth straightened. That's a feature that's also available for the spine. You could have, not braces, of course, but you could have chiropractic care to straighten a crooked spine if, in fact, you inherited one. So we want to be clear about that with the parents in the sense that we're seeing that they have subluxations, or at least one of them does, and we're concerned that that may be inherited to the children. And now we want to go ahead and schedule appointments based on that concern. And if you do it truly from that concern, we can then encourage the patient to invite them in, to schedule appointments for their children. Then their children will come in, we'll get to check their spines and make sure that they're healthy and happy and doing great, and also for the spouse. So that's where we want to bring in families into chiropractic care in our office so that they can all get healthy at the same time. The second is to pass off your patient to the CA, and that happens at the front desk after the first adjustment. The way that works is we're going to walk up to the front desk and we're going to repeat the exact recommendations that we just went over with the patient. We're going to repeat it for a second time to the CA at the front desk. Never mind the fact that your CA has heard this 1,000 times. What we want to do is repeat it back so that the patient hears you saying it to the CA in front of the patient, so there's no question about what the recommendations were that were explained in the room. So when you walk the patient up to the front desk, explain to the CA exactly what you're recommending for the patient, including their adjustments, their re-exams, their re-x-rays, the orientation appointment or the spinal care class. Explain all that to the patient or to the CA in front of the patient so that they're clear. And the financial arrangements. You're going to also explain the financial arrangements. I recommend that the person who does the report of findings does the financial arrangements. So it's seamless, it's connected, and it's all with one person. That way the patient can feel most comfortable in terms of their total arrangement package. So make sure you walk the patient up, make sure it's a clear handoff, pass the baton, give it to the CA, and then the CA can take it from there and set up your patients, not only their initial appointments, but basically their appointments on an ongoing basis. Thank you.